Rosuvastatin can reduce bad cholesterol by up to 50%. This is not a manufacturer's promise. It is documented in decades of solid clinical studies. But what almost nobody talks about is what really happens inside your body when this medication kicks in, and why so many people stop taking it without telling their doctor, thinking they are doing the right thing. There is specific information about the side effects that completely changes the way people see this medication, and I am going to get there. Before the end, I am going to show you a sign that can appear in your urine that very few people know how to identify. A silent sign. A rare sign, but one that can change everything if you are taking this medication. But to get there, first you need to understand something that maybe nobody has ever properly explained to you. I am Dr. Thomas Ellsworth. I have studied the impact of cholesterol on the cardiovascular system long enough to have seen patients save their own lives taking this medication, and to have seen others lose that chance out of pure fear from something they heard in a video online. If you are not yet subscribed to the channel, subscribe now. What comes next could change the way you take care of your health for years to come. Let us start from the very beginning. Your liver makes cholesterol. Yes, your own liver. It is not just food that matters. A large part of the cholesterol circulating in your blood comes from an internal factory. A factory that works all the time, without warning, without rest. And the one running that factory is an enzyme with a complicated name, HMG-CoA reductase. Think of this enzyme as the main switch of a production line inside your body. While that switch is on, your liver produces cholesterol on an industrial scale. Even when you are fasting, even when you are asleep, even when you have not touched anything fatty all day long. Rosuvastatin does something simple and brilliant. It turns off that switch. Not completely, not forever, but enough to cut production almost in half. That is why this statin is considered the most potent one available on the market today. It acts directly at the source of the problem. It does not try to clean up the blood after the damage has already been done. It prevents the damage before it happens. And here comes a detail that almost nobody mentions in the doctor's office. Rosuvastatin does not just lower cholesterol. It does something else. And it is that something else that actually saves lives. Most patients have never heard about this. Inside your arteries, over the years, plaques form. Pieces of fat, inflamed cells, accumulated cellular debris. Some of these plaques are stable, others are unstable. The unstable ones are like time bombs glued to the wall of the vessel. Small, silent, unpredictable. When one of them ruptures, blood forms a clot right there on the spot. And that clot blocks the artery suddenly. That is exactly how most heart attacks happen in this country. Not the plaque slowly clogging things up the way many people imagine. It is the plaque that ruptured out of nowhere, without warning. Rosuvastatin steps in right there. It covers these dangerous plaques with a kind of stabilizing layer, a calcium cap that seals the plaque from the outside, like a piece of armor. The plaque still exists, and that is important to understand. But it stops being a bomb. It turns to stone. It becomes something predictable, something that will not catch you off guard in the middle of the night. That is why this class of medication changed the history of modern cardiology. Not because of the cholesterol number on the test, because of what it does to the walls of the arteries, on the inside, where no routine blood test can truly see. Did you know that was what rosuvastatin was doing inside your body? Leave a comment and let me know how many of you already had that information at the tip of your tongue. And it is precisely because of this mechanism that many patients with apparently normal cholesterol on their test still receive a prescription. Something that confuses almost everyone. That creates doubt. That creates frustration sometimes. If you have been through that and never truly understood the reason, pay close attention, because the explanation is not in the number on the test. It is somewhere else entirely. Medicine today no longer treats just the number. It treats the whole patient. There is a calculator that cardiologists use to estimate your real risk of having a heart attack or stroke over the next 10 years. It takes into account age, blood pressure, diabetes, family history, whether you smoke, whether you have already had a cardiovascular event. And it is based on that calculation that your bad cholesterol target is set. It is not a universal target. It is a personalized one. For a young person with no diseases and no history, maybe an LDL of 150 is not a big concern. For someone with diabetes, high blood pressure, and a father who had a heart attack at 55, that same number of 150 is already a time bomb. That is why two patients with identical test results can receive completely different treatments. That is not injustice. That is science applied to the right person. And here is where one of the biggest mistakes lives. Many people think that a normal test means being free of risk. But normal for who? Normal compared to what? The blood of someone who has already had a heart attack cannot work with the same cholesterol range as someone who never has. That patient needs a much more aggressive target. And that is exactly the point where Rosuvastatin comes in with force. Now I need to address a topic that is probably the reason a lot of people have stopped taking this medication without even mentioning it to their doctor. The question of memory, of the dreaded dementia. You have probably seen a video, a headline, or heard someone in your family say that statins melt the brain, that they cause Alzheimer's, that they erase your memory. I'm going to tell you what the science proves, and I'm going to tell you calmly. The brain produces its own cholesterol. It does not depend on the cholesterol circulating in the blood to function. There is a barrier that separates the brain from the rest of the circulatory system called the blood-brain barrier. And rosuvastatin specifically is a molecule that barely crosses that barrier. In other words, it cannot get inside to interfere with the brain's own cholesterol production. That is a chemical fact, not an opinion. Beyond that, decades of patient follow-up in serious studies show the exact opposite of what spreads on the internet. People who take statins over long periods have fewer strokes, fewer cerebral infarcts, fewer ischemic episodes in the brain. And what protects the brain in the long run? Exactly that. Healthy arteries, a well-irrigated brain, preserved nerve tissue. So when someone tells you that statins cause dementia, remember one simple thing. The leading cause of vascular dementia is the clogging of the small arteries of the brain. And rosuvastatin is exactly the kind of medication that prevents that clogging. Had you ever heard this explanation about statins and memory? Leave a comment if you or someone in your family ever stopped taking it because of this fear. But hold on, this does not mean this medication is harmless. It is not. There are real side effects. There are. And it is important that you know how to tell the difference between serious information and rumor. The most common effects show up in somewhere around 5 to 10% of patients. And the number one complaint is muscle pain. But pay attention. Not every muscle pain in someone taking a statin is caused by the statin. There is a psychological phenomenon documented in serious studies called the nocebo effect. It is the opposite of the placebo effect. The person reads in the package insert that it can cause pain, starts waiting for the pain, and the pain appears. Even when the medication is not to blame, how do you know if the pain is real? What separates a common discomfort from something that deserves concern? I'm going to explain exactly what to look for. I will show you where the pain tends to show up for real. And I will get to that rare sign, the one that appears in your urine, that can be the difference between a small scare and a serious complication. Muscle pain caused by rosuvastatin tends to show up in large muscle groups, thighs, shoulders, back. It is not an isolated twinge in a small muscle. It is a more diffuse pain, as if the muscle feels tired even without any effort on your part. It usually appears in the first few weeks of treatment, and when it goes away for good. If you feel this, do not stop the medication on your own. That is one of the most dangerous mistakes there is. You stop taking it and the protective effect starts fading from your body within weeks. Talk to your doctor. There are solutions. Adjusting the dose, trying alternate days, switching to a different statin. All of that is possible inside a doctor's office. Now there is a sign that is different, a sign that needs immediate attention, a sign that very few people know about. When the muscle enters a rare but serious condition called rhabdomyolysis, it starts releasing a protein called myoglobin into the bloodstream. That protein ends up in the kidneys, and it makes the urine turn a color that is different from normal. A color that looks like dark tea, almost like cola. If you are taking a statin and you notice your urine has turned that dark, along with intense muscle pain, weakness, and difficulty even getting up from the couch, that is not the time to wait and see. That is the time to seek medical attention the same day. It is rare. It happens in a very small minority of patients. But it is the kind of thing nobody can ignore. But take a breath. That scenario is the exception, not the rule. The vast majority of people take rosuvastatin for years without any serious symptoms. What you need is to know how to take it the right way. And that is the important part. The dose usually ranges between 5 and 40 milligrams per day, always defined by your doctor. And contrary to what many people believe, rosuvastatin does not need to be taken at night. Older statins had that requirement because of their short duration of action. Rosuvastatin has a much longer half-life. It works throughout the entire day. You can take it in the morning, you can take it at night. What matters is consistency. Every single day at the same time. Another thing most people do not know. Grapefruit can interfere with the metabolism of this medication. In the case of rosuvastatin, the effect is smaller than with other statins, but it is still worth avoiding. Grapefruit juice every morning on an empty stomach, right alongside the medication, is a recipe for trouble. And pay close attention to this. Taking rosuvastatin is not a license to eat whatever you want. That is one of the biggest misconceptions out there. The person starts the medication, sees the cholesterol drop, and relaxes with food. Goes for the fried food. Goes for the cheese. Goes for the ice cream. Thinking the medication holds everything together. It does not. The effect of the statin is amplified by diet, exercise, and weight control. If you cut those three out, you are throwing away half the benefit of the medication. Quick comparison. You have probably heard of Atorvastatin and Simvastatin. All three belong to the same family, but with different levels of potency. Simvastatin is the oldest and the weakest. Atorvastatin sits in the middle. Rosuvastatin is the most potent. To reduce the same level of cholesterol, you need a lower dose of rosuvastatin than simvastatin. That generally means fewer side effects and better results. About the kidneys. Here is one last important piece of information. Rosuvastatin is eliminated by the liver, not the kidneys. It does not directly attack kidney tissue. What can happen in rare cases of rhabdomyolysis is an indirect overload. But the medication itself does not destroy kidneys. That is one more rumor. This medication is one of the most solid pillars of cardiovascular medicine over the last 40 years. It saves lives every single day, in silence, inside millions of bodies around the world. You will only feel what it prevented on the day it fails. And the day it fails is almost always the day it stops being taken. Tell me in the comments, after everything you heard today, did your fear of rosuvastatin increase or decrease? And have you ever stopped an important medication on your own, thinking you were doing fine, and later regretted it? I want to read your answers. If this content helped you, leave a like, share it with someone in your family who takes this medication. Subscribe to the channel and turn on the notification bell so you do not miss the next videos.